Hello and welcome. I'm your host, Neil Howard. Thank you so much for returning for another segment. We've got returning guest Dr. Paul Limburg joining us as Chief Medical Officer Screening at Exact Sciences. Welcome back. Paul, how have you been?
I've been great, Neil. Pleasure to be back.
You're back today to talk about some recent research that revealed that there are reasons why 45-year-olds here in the United States aren't getting screened for CRC, despite recommendations by national screening guidelines. Tell our listeners who may not be familiar with you as a contributor a little bit about yourself, and then let's talk about some of these guidelines for CRC.
Yeah, happy to, Neil. Paul Limburg. I'm a gastroenterologist. Was in practice for 25 years before joining Exact Sciences as Chief Medical Officer. Really appreciate your interest and the interest of your listeners to this really important topic. CRC, or colorectal cancer, is an all too common condition. It's been called one of the most preventable yet least prevented diseases. And today's focus is on some trends that we're seeing that are somewhat disturbing with rising rates of colorectal cancer in a younger population.
Previously, the recommendations for screening were at a higher age than 45, correct?
So traditionally, colorectal cancer screening initiation was recommended starting at age 50 for patients who were at what we would call average risk. Sometimes if there was personal history, family history, those recommendations would be to start at younger ages. But now more recently, major guideline groups have moved that age of initiation to 45 years.
Now, why is timely initiation of screening so important?
Yeah, I think it's just the simple fact that the earlier someone gets screened, the better the opportunity to either detect colorectal cancer at a more curative or potentially curative stage, and even better, finding pre-cancers that could be effectively removed so that colorectal cancer doesn't even form.
It's my understanding that Exact Sciences recently conducted a survey, the IM45 survey. What were some of the most significant findings from this survey?
Yeah, this was a relatively unique project, a very robust activity informed by a steering committee of national experts that involved over 1,000 participants. The goals of the survey, Neil, were to really identify the beliefs, the barriers, the behaviors that might be contributing to what we would call less than ideal participation in colorectal cancer screening in this younger population. And really three key areas to highlight from the data. First, 3 out of 4 45-year-olds indicated that there was at least one reason why they would either delay or avoid colorectal cancer screening. The survey data that dove into some of the details showed really a wide variety of reasons why 45-year-olds are not getting screened. And it's really just not one single barrier, but there's multiple different obstacles, if you will, at the patient, provider, and system levels. So with respect to patients, some of the most cited barriers were lack of time because of everyday life responsibilities, work, family, etc. Lack of awareness about risk factors for colorectal cancer, and also when and how to get screened for colorectal cancer. Fear and stigma also were cited by the survey respondents as potential barriers. Patients are afraid of getting bad news from a screening exam, and people are still hesitant to talk about colorectal cancer or colorectal cancer screening. A couple others at the patient level, this is not an area of priority for 45-year-olds. They generally are feeling good and feeling fit, so colorectal cancer screening isn't top of mind. And then just 2 others to call out. Lack of recommendation from a healthcare provider was also a very common reason why these 45-year-olds say they weren't getting screened. And some also were concerned if they were uninsured or underinsured that there may be costs associated with screening or the follow-up after screening if there was anything found on the initial exam.
So with all of these negative opinions, what are the options for screening? Aren't they convenient, not necessarily very invasive? What tests are available?
Yeah, there's a large mix, and what the data show is that offering informed choice is the best way to motivate participation. So having a conversation with a healthcare provider to pick a screening option that works best for that individual is the best way to go. And you're right, there are test options that are relatively more invasive, things like colonoscopy, which requires a preparation prior to the evaluation, oftentimes is done under sedation, so may require time away from work, need for a ride home, etc. Can be some complications associated with procedures that are more invasive, like colonoscopy or something called flexible sigmoidoscopy. There are imaging studies, X-ray tests like CT colonography. This also requires a prep before the procedure and doesn't have quite the same extent of insertion, if you will. So it's not typically done under sedation, but is an office-based procedure. And then there are some home-based options. Multi-target stool DNA, or Cologuard, is the brand name for that test, that looks for signals in the stool. This test can be done at home, can be returned from home, and the results are analyzed and interpreted in the lab. There's also home-based stool tests that look just for blood in the stool called FIT or FOBIT. So a large variety of options that can meet the needs of, busy, healthy 45-year-olds who still need to get screened.
You mentioned one of the barriers being not having informative conversations with their healthcare provider. The providers who aren't specialists in this area, are they aware of the options and some of the misconceptions associated with getting screened at age 45? Are they in a position to actually give good advice on the options?
I'll speak from experience more than data, Neil. So the study that we did, the IM45, was really focused on the people who would be eligible for screening. But I think there is, probably a lack of awareness or lack of sufficient awareness in among providers as well. So there are education opportunities to inform that colorectal cancer screening is still necessary, men and women, but now beginning at age 45 instead of the traditional start age of 50, according to most national guidelines. So a lot of opportunities for us to get the message out there, to make sure that we are doing everything possible so that people who are eligible for screening know when they should start screening, know how they can get screened, and can find an option that works best for them.
Give us a website where listeners can learn more.
Exact Sciences is the company that I work with, and Exact Sciences makes the Cologuard test, but there's a lot of good information about colorectal cancer on the exactsciences.com website.
Paul, I thank you so much for returning. Hopefully you'll come back and give us some more information.
Appreciate the opportunity, Neil. Thanks for your interest again in this important story.
You've been listening to Health Professional Radio. I'm your host, Neil Howard, in conversation with returning guest Dr. Paul Limburg. Audio copies of this program are available at healthprofessionalradio.com.au, also at Anchor, Spotify, and be sure to subscribe to our YouTube channel at youtube.com/Health Professional Radio.